In this video, I'm going to talk about why painkillers are questionable in the use of back pain, especially as a long-term solution to back pain. We see patients time and time again that are given these and they come back to us and they say, I've been given painkillers, but I don't know why, I don't know how it's supposed to help me, and it's really not helping anyway. If anything, it's helping them get worse. And the first thing you really need to understand is, we'll talk in simplistic terms in this video, but it should help get the message across, essentially. So the main structures in the lower back that you're going to injure are going to be the discs, they're going to be the facet joints, and the other ligamentous structures and small muscular structures that support and protect the lumbar spine. And in reality, you're going to more often than not injure more than one of those at any one time, because it's very difficult to get one tiny bit injured when they work in such an interrelated manner. But fundamentally, it's a strain of the ligament or damage of the ligament. Now, if we go and compare that to your ankle, if you sprained your ankle, you went to your GP and they said, here, take these strong painkillers and just walk it off, you'd look at them and think, that doesn't sound very clever. What they'd actually do is say, here, maybe take these painkillers, but let's put it in a strap to support it. Let's take that leg off weight bearing, maybe use this crutch for the next couple of days to take the pressure off, because they know that you continuing to walk on that sprained ankle, where the ligaments, the weight bearing and supportive structures of that ankle are not going to be able to effectively work, and they're more likely to be injured with repeat use, especially if you don't have the inhibition of pain stopping you from putting extra pressure on that ankle. So why then do they say, here, take your painkillers and crack on with your lower back? It doesn't quite make so much sense. Now, in reality, with the lower back, you can't isolate it the same way you can an ankle, so there are some issues with that example, but you want to pay attention. You're in pain in the lower back because you've just injured your lower back, and using painkillers to just numb the sensation of pain so you can carry on causing more damage is not a sensible move. Generally speaking, that pain will tell you that, whoa, don't do that, because you're going to squash that disc more, for example, with bending forwards being a problem for people with disc injuries. Or it might be, arching backwards is a problem because you jam these facet joints together and they're already injured and we don't need to squash them anymore, so I'm going to tell you you're in pain so you avoid causing more damage. So the pain does have a purpose in some respects. It doesn't necessarily need to be quite so severe, so taking an element of painkillers can be necessary in the short term. But you have to question, do you want to eliminate the pain with painkillers, or is the pain there to serve as a warning for making things worse? A lot of patients want more of a solution rather than just numbing the pain. Now, are there certain scenarios where painkillers would make a good bit of sense? Yes. If your pain is stopping you sleeping, those sorts of things, then you need your sleep. Your sleep is when you're recovering. If you can't sleep effectively because of the pain, then painkillers can quite often be a substantial source of relief, because the reality is you're not going to injure yourself in your sleep. Whether or not it's painful, that's inappropriate stimulation. But taking painkillers so you can go on the treadmill for an extra 15 minutes at the end of your workout is not necessarily the smartest move. So a lot of patients nowadays we find in the clinic are actually telling us this. They're not telling, it's not the case of we're telling them that. And they're aware of the fact that painkillers aren't necessarily the best approach. So if you do have back pain that's been going on for a longer period of time, especially anything beyond a week or two, and it's not actually getting any better, and all you've been given is painkillers, take some ibuprofen, take some paracetamol, or some other stronger pain medications, then really start to ask yourself the question, is this really helping me with the problem? Or is this kind of masking the pain so I can do more damage? And if you come to the sort of a certain conclusion there, then go and see someone that can actually help you and give you the treatment that you need. And on our website, we've got videos and other articles that can give you a bit of guidance on what you can do at home about these sorts of things, and measures you can take to stop the back pain getting worse, and those sorts of things. But it's always best to see your local practitioner, because they will be able to help you in a more tailored way. So do get those things sorted, and try your best not to rely on painkillers during the day so you can do more damage. Thanks for taking the time to watch this video. For more videos like this and recent uploads, click the link up here. If you want to learn more about our Back in Shape program and how it can help you from home, then click the link here. And remember, to stay up to date with all the latest videos we post, subscribe by clicking the button above my head. Thanks for watching.